Hello, welcome to Boston Bone & Joint Institute. If you're watching this video, your provider may have recommended performing exercises to help with arthritis in your thumb, also known as your basal joint, carpometacarpal joint, or your CMC for short. The purpose of these exercises is to strengthen the muscles around your arthritic thumb joint, which can make it more stable and less painful. It is important to note that these exercises can help with pain control, but will not eliminate your arthritis. These exercises should be performed gently and should never be painful. These exercises can be completed on both hands, even if only one hand has arthritis or is experiencing pain. The first exercise is the imaginary ball. To perform this exercise, pretend that you're holding an imaginary ball and let the ball slowly expand while you're keeping your fingers curled. Hold for a count of 5 seconds, rest for 5 seconds, and repeat 10 times. The second exercise is the thumb pinch. To perform this exercise, form a circle with your thumb and index finger. Squeeze your thumb and index finger together to tighten the muscles of the thumb. Use your other hand to feel if those muscles are contracting. Hold for a count of 5 seconds, rest for 5 seconds, and repeat 10 times. The third exercise is the thumb perpendicular push. Set up for this exercise with the pinky side of your hand resting flat on a table and your thumb pointed towards the ceiling in a neutral position. Using your other hand or fingers for resistance, push downward with your thumb and don't let your thumb move. Your other hand should stop any movement from happening at the thumb. Hold for a count of 5 seconds, rest for 5 seconds, and repeat 10 times. The fourth exercise is the thumb outward push. Set up for this exercise with your hand resting flat on a table and your thumb in a forward position, creating an L appearance. Using your other hand or fingers for resistance, push outward with your thumb as if you're trying to make the L bigger. Do not let your thumb move, and your other hand should stop any movement from happening at the thumb. Hold for a count of 5 seconds, rest for 5 seconds, and repeat 10 times. The fifth exercise is the index finger push. Set up for this exercise by placing your hand flat on a table. Using your other hand or fingers for resistance, try to move your index finger towards your thumb. Do not let your index finger move, and your other hand should stop any movement from happening at the index finger. Hold for a count of 5 seconds, rest for 5 seconds, and repeat 10 times. The sixth exercise is the stable pinch. To perform this exercise, form a circle with your thumb and index finger. Place your other index and middle finger on the palm side of your thumb knuckle. Using your other fingers for resistance, try to move the thumb knuckle closest to your palm towards your pinky finger. Do not let your thumb knuckle move, and your other index and middle finger should stop any movement from happening. Hold for a count of 5 seconds, rest for 5 seconds, and repeat 10 times. The seventh exercise is putty thumbprints. Using your thumb, index, and middle fingers, perform light squeezes into the putty to make fingerprint impressions. Alternate between the index and middle fingers as you would like, and alternation can be random. Maintain the circle position and perform this continuously for 30 seconds, resting for 15 seconds, and repeating 10 times. The eighth exercise is the pinch strengthening. To perform this exercise, form a circle with your thumb and index finger. Place the putty in your hand and squeeze the putty with your other fingers. Do not move your thumb knuckle and make sure to maintain a circle position. Perform this continuously for 30 seconds, rest for 15 seconds, and repeat 10 times. These exercises can be completed as many times as you would like throughout the day, but we recommend at least once or twice a day. If you find that you're sore the day after completing these exercises, you can reduce the amount of repetitions, the duration of the holds, or the amount of times you perform the exercises each day. You can also use ice, heat, and over-the-counter pain medication as directed by the label on the bottle, and or bracing to assist with soreness as recommended by your provider. Performing these exercises consistently for an extended period of time may reduce the amount of pain that you're experiencing from basal or CMC joint arthritis. If you have any additional questions regarding these basal or CMC joint arthritis exercises, please contact our office by phone or message through the BBJI portal to speak with a member of our clinical staff.